Hello viewers, welcome to another edition of Health Reports. I'm still yours, Mojima Konjola. On this edition of Health Reports, we'll be looking at the heart, an important organ of the body, and which in recent times have come under microscope, indeed, to ascertain why are we having more and more people coming down with cardiovascular diseases. That's the take today as we join the rest of the world to commemorate the World Heart Day. World Heart Day commemoration started in the year 2000, and the rest of the world have come together to give a critical look at heart conditions. And nobody is free. Young, man, woman, babies all have problems or some conditions with the heart. But most disturbing is the one associated with sudden deaths, and that's what you get all the time. We'll attempt to put this together for us to understand how best to keep your heart and what to know about your heart on this edition of Health Reports. And we have an expert in the house. When we return, the conversation will begin. Stay tuned. You're welcome back, and this is Health Reports. Now, we're talking about the World Heart Day, and we're actually looking at the functionality of the heart as it affects the well-being, the total well-being of the individual. When the experts are saying for this year's commemoration that you need to know your heart, you need to fuel your heart, you need to move your heart, and most importantly, love your heart. So within these thematic areas is where the discussion will center as I introduce our expert in the house, who is the Executive Director, Nigeria Heart Foundation, able Dr. Kingsley Kola Akinroye. Sir, you're welcome.
Thank you.
And thank you for coming all the way from Lagos.
Yes.
Yes, it's nice to see you here.
It's
now, we're looking at a whole gamut of things that affects the heart, and the world is saying that we need to pay special attention to the heart. Would you like to give me a scenario of what heart, what are we doing with our hearts in Nigeria?
Thank you, Muji, and I want to say congratulations on bringing this important topic to the fore in Nigeria. We recognize that the heart is the most important organ in the body, which starts functioning right from the womb until death. So every second is so important to the heart, and this has to do with the circulation of that important organ we have, the blood system. So the blood needs to be pumped every second round over the body. And the engine house is the heart, and that is why the heart is important. So the heart has a mechanical effect. It also has electrical effect, and at the same time, it has a functionality. That is why the heart is so important. And over the years, we have now come to recognize that this important organ needs to a special attention on it. And that has come to the front since the year 2000, when the world actually recognized that. And our organization, the World Heart Federation, which is made up of national heart foundations all over the world, came together in Geneva and decided that we should pay attention and we should direct attention to each country in the world should dedicate a day in which they have an attention to look at the heart. And that is why we're here today. And September 29th every year has been declared as a World Heart Day. Yeah. And this has the reason why we are marking this.
Okay, so we are here paying attention to the heart.
To the heart.
The most important organ in the body. No heart, no life.
No life. No
okay,
life.
Right. So let's look at cardiovascular diseases. I mean, in plain language, it's just heart diseases. What are we seeing in Nigeria? What is the trend?
Well, I will bring it also to know. It's a big language when you say cardiovascular. Cardio in Latin words means the heart, and vascular means the blood vessels. Actually, the heart itself is a blood vessel. It's just the biggest blood vessel in the body. But again, all other blood vessels are also important. So that is why you call it cardiovascular. And diseases of this heart organ are also the #1 biggest killer disease in the world today. And we do know that about 17.5 million people die of heart disease every year. And out of these 17.5 million people globally, you'll be surprised that 80% of these diseases are in developing countries.
Nigeria inclusive.
And of which Nigeria is very, very inclusive. And there's a projection by the year 2030, this is going to go to about 23.3 million. Right there, 80%, we have a projection of that, even in Africa, when you look at it. And globally, even as of today, we have about 10% of our adult population in Nigeria suffering from heart disease. And when you have a projection of that, that is even going to about 10 million.
That's huge.
And that is very huge. So Nigeria will lose a lot of people, even from heart disease, when you look at this. And scientists are trying, and that is why the National Heart Foundation is there, which started about 25 years ago, paying attention to the heart, because we know the heart, the only way you can do is prevention.
Prevention. So that's good. Let's talk about prevention now. How do you prevent, or how do you ensure that you have a healthy heart?
Thank you very much. When you started, you were also saying, this year we are saying you must be focus yourself on the heart. You must be aware. So we are raising the awareness of the heart through the education we are giving today, through this fantastic program you are giving. We want the body, everybody, to raise the awareness of that. So you must be aware of what is the heart yourself, because before you prevent it. And the ways of prevention are exactly what you are saying. The number one way of preventing is through diet. Our nutrition is highly, very, very important. And what do we talk about nutrition? Every food we eat has an implication on the heart. And the sensitive ones that we know also in Nigeria, in Africa, is salt. Salt is very, very important, and because our number one heart disease is hypertension. And that's an association with salt. So the more salt you take, the higher your blood pressure. And that is from the womb. So our focus is even from the children down to the adult population. So we are now saying that you must take less than 5 grams of salt per day. That is also our message. Take less than 5 grams of salt per day. And then we also know that we focus also on the intake of fat in the body. When we talk of fat, at the end, any fat you take gets translated to cholesterol. We talk of the saturated fat, we talk of the trans fat, and that is why the Nigerian Heart Foundation has also been focusing on looking at how do we reduce the content of cholesterol in our diet, because cholesterol gets deposited in the blood vessels, gets deposited in the heart, and leads to heart attack. So if you start looking at that, reduce the cholesterol content in your chances of developing heart attack or dying suddenly gets reduced. And that is what the Nigerian Heart Foundation is preaching in the country, trying to regulate with NAFDAC the amount of cholesterol in the diet, and the Nigerian Heart Foundation has a label given to manufacturers of some products in Nigeria. Yeah, salt is also very important. Reduce the amount of salt you take in your diet. And again, we talk of the sugar intake. Sugar is also very important, and we talk about refined sugar. So the emphasis we are making is that you take a lot of sugar that are natural. Every food product we get contains sugar. Our eba, amala, fufu, yam, they all contain sugar. But we are saying, take more of that, take less of refined. So refined sugar is a poison. And that's why we say, try to avoid, whatever you are, from childhood to the adult level, try to avoid the amount of sugar you take in the drinks, in your system, taking raw sugar, taking refined sugar. So that is diet on its own. Also, when you then move again, we also talk about tobacco. Tobacco is also a dangerous poison, and that is why we are very grateful to the Nigerian government that has passed the tobacco law. And we also have about 6 states also that have passed the tobacco law. But we have to give that credit to our last president, President Goodluck, who signed the treaty, who signed the bill on tobacco law. But we are still back on the implementation. Lagos State is trying to implement that. That means in offices there should be no smoking. At home there should be no smoking. In your car when you are going there should be no smoking. So these are the way. Tobacco is also another dangerous agent. The other one is physical activity, which we are also saying that is very, very important. When you talk of physical activity, you talk of exercise. You talk of how do you move your body. you should sit less. And we are also preaching that. Sit less, move your body. That is part of what we are talking, you said today. Try to activate your body. Make sure, say, use natural active movement. That is the preaching we are doing this. And this should also start from childhood, especially in our schools. Most of our schools these days, they don't have playgrounds anymore, which we used to have back in the 60s, in the 70s, in the 80s. So we are also saying to the federal government of Nigeria and also the state government, please provide children, when they're in school, with arena to exercise and inculcate, not only to teach them how to exercise in the class, take them outdoors and let them exercise the body so that we have a healthy population. We have a healthy population. You'll be amazed also that our lifespan is dropping sharply. And I'm sure you're also going to get into that. And lastly, also, we also talk about the alcohol intake. Alcohol is also very dangerous to the body, and we try also to reduce that. And also the blood pressure, which is also one of the risk factors for cardiovascular disease.
Yes, we've been talking about the risk factors. We've spoken to diet, we've spoken to exercise, general well-being of the body, because the heart, as you rightly said, I mean, as a doctor, you know, and for us to know also that it's the most important organ in the body. Having said that, fuel your heart. You know, that's one of the thematic areas where, the conversation around the World Heart Day celebration is hinged upon. So what do you mean when you say fuel your heart?
Yes, fuel your heart is also an indirect way of saying be careful what you take into your body. Because everything you take into your body is like empowering the heart and goes through the heart. So that starts from the food you take into the body, which we have mentioned about the type of food you take. You must be aware and conscious of that. Every food you take has an implication on the heart, which contains the carbohydrate level. The carbohydrate level, the sugar level must not be high, the fat content must not be high, the salt content must not be high. And again, too, part of fuel is the air you breathe in. Make sure you breathe in a non-polluted air that does not contain tobacco smoke. So that is part of what we are trying to say. So we are trying to interpret the message that people, it's simple enough to know that fueling your body is so important in terms of, because everything you do gets to pass through the heart.
And well, again, we've spoken to prevention, and we've spoken to all the risk factors. We've spoken also to how to prevent, any of these diseases coming on. Supposing you're down with a heart disease, would you say that in Nigeria we have facilities to treat heart disease, or it's still one of the setbacks in the health sector?
The first thing is what you say. Well, our emphasis is on prevention. We try to do that because the moment you get a heart disease, is for life. And you can imagine that countries all over the world that are conscious of this, back to the 60s, back to even to the 50s, who have been very conscious of this, they live longer than most in developing countries. And that is a relation, that is why the emphasis on prevention. However, the more you age, the more chances are that this body gets tired. But if you empower it, you do it the right way, you exercise, you are likely not to develop a heart disease faster. Because we are saying there's no reason why people should not live more above the age of 75. Most of these countries we are talking about today, talk of Finland, talk of Japan, talk of United States of America, the average lifespan is above the age of 70. Even there are countries that live above the age. But when you come to Africa, you'll be lucky to cross the age of 50. And that is also that is dropping. So, however, if you develop a heart disease, it's forever. And that means that you need to take a care. So care for the heart is still very new to us in Africa. And our government needs to focus on it. We have hospitals. But again, everything is not in hospital these days. You can do a lot by yourself, even from home, to make sure that you don't develop. Because we have just mentioned that our number one heart disease is hypertension. Everybody's blood pressure from the womb starts to increase, and that is why we are focusing on that. But if you develop a heart disease, what do? See your health professionals. And your health professional starts from your door. Your nurses are also health professionals. There's a lot they can do. You go to the health center, then you see your doctor, and at the primary care level, also they can also take care of you at the secondary care level and at the tertiary care level. But all our 3 tiers of care in our own country, Nigeria, is still not adequately prepared to take care of the heart.
Or some of the complications that come
from the complications that come from the heart disease. However, Nigeria government has been trying, because far back as the mid-90s, Enugu Teaching Hospital was designated a heart specialist center for center of excellence. Heart. But how far have we gone? You cannot compare with what is happening in Ghana. You can't compare with what is happening in South Africa, and even a smaller country like Uganda. They have functional heart center, and this is what we are saying. We should be able. We do not have to cross Nigeria.
Cross the borders.
Cross the borders. You have to go to South Africa. You have to go to India. You have to go to America. You have to go to England to take care of the heart. Even Sudan, which is just next door, they have got a national heart center which is functioning very well. So our government needs to be conscious, and that is the responsibilities of National Heart Foundation and also ancillary organizations to be able to look at the policy that we have. Not only that we have the policy that is there, we must have a functioning policy to be able to look at the people. Because heart disease is so expensive. And the amount of money we spend every year ferrying people outside Nigeria, especially to India, you will be amazing how much we lose every year. No, not only that, we are not training our personnel. We are not training the young professionals who are supposed to take care of the country. That is why the National Heart Foundation, Nigerian Heart Foundation, is also very concerned. Although the Nigerian Heart Foundation works with the Federal Ministry of Health and the national government, but we feel by now we should have a functional National Heart Center.
To complement what we have in Enugu.
To complement what we have in Enugu. There's no center you get all over the world today. And I say with all authority, where you want to find Nigerians who are doing excellent work. They are ready to come back home, provided we have a functioning heart center. Because I've just mentioned to you, can you imagine taking care of 10 million people, adults with heart disease? There's no reason why the way we look at malaria, the government cannot subsidize heart care in this country, because that is part of a responsibility. Health is a right. And until we are able to establish that, our national health insurance is there, the government can also be able to say that heart care should also go under national health insurance. So the moment you have a heart disease, you should also be able to get that and get subsidized. But again, like you say, the policies are there, the implementation is very poor, and smaller countries are doing it. Seychelles is doing it. Just a very small country, tiniest country in Africa. I just mentioned Uganda is doing it. Ghana has just started a brilliant national heart center which is going to take off very, very soon. So there's no reason why we shouldn't be able to do it. And we hope our government, which we believe part of what we are doing to date, we are empowering the people. We are also empowering the government to take action. And this is the right time to take action.
And I want to just chip in that is a collective responsibility.
Thank you.
While you have, while we are pushing or advocating for specialist centers, Nigerians also need to take advantage of the prevention methods that are available to look after their hearts. But beyond that, we also have what we call the PPP, the private public mix. I think that also should look at what we are doing. Okay. Before I let you go, sir, there's also talking about love your heart. I think that it's a good way to round up the program with you. So how do I love my heart? By all the prevention methods?
You know, the heart is a very lovely organ. I'm sure you celebrate the Valentine every year, and the heart is red. Everybody wears. I'm very happy this morning that
I'm wearing red.
That Moji, you are wearing red, and love your heart. Be fully aware that there's 90% of a lot of things you can do for yourself in terms of prevention, but it's collective responsibility. The individual has got responsibility. There's also corporate responsibility, just like what you are doing now. All institutions, industries where we work, the ministries also should be able to look at their workers. Let everybody be conscious of their blood pressure. Be able to measure your blood pressure. we have not mentioned what you can do for yourself in terms of weight reduction, because weight is also very related. So check your weight and make sure that that is also what you can do. Make sure that you live in an environment that is not polluted. Tell people, we have a law now which bans smoke in that environment.
Smoking out.
Smoking, and
smoking.
you can public smoking even at home. So there's a lot you can do. A lot you can do to your diet. When you love yourself, even what you put in your plate every time should be colored. The more several colors you have, the more healthy is the food you are taking.
Yes. Just finally, before I let you go, sir, we're speaking to ourselves. We understand the language that we are using for this conversation. How do we get to the grassroots? Because do you get people at that level coming down with heart diseases?
Yes, we do. The heart, everybody has got a heart. And so the heart disease is no respecter of persons, it's no respecter of age, it's no respecter of sex, it's no respecter of color. So it's everybody. Yeah. So it starts from the womb. And what have we been doing? That is why since year 2000, both at the national level, at the global level, there's a focus on that. Awareness is so important. And this has gotten even to the United Nations. That is why in year 2011, we went to the United Nations to hope to declare a summit on it. Another one is coming up next year too, where we are going to have another summit to discuss on how far have we gone at the global level, at the national level, to be able to assess. But to answer your question, we want this awareness to get around to the grassroots. Nigerian Heart Foundation and other organizations are also coming up to preach the message. We have an awareness program. The Nigerian Foundation is starting also partnership with the federal government to get to the local government level. And we have identified, for your instance, we have identified the Federal Road Safety Commission. The Nigerian Foundation has started working with them, and we want them because they touch everybody. And they can also pass the messages faster as a route of getting to the people. We also want the local government now. We have so many state governments are celebrating the World Heart Day today. And the ambition of Nigerian Foundation is that by the grace of God, which we know that is behind us, we want every local government also to celebrate the World Heart Day, just like we do our October celebration, so that everybody will be fully conscious that they have a responsibility to take care of their heart.
Thank you very much for your time, and on that note, that everybody has a responsibility to take care of his or her heart, and of course starting right from conception, which is so important. Well, what I can assure you, sir, is that Health Reports on NTA will continue to partner with you so that we all have a healthy heart for a healthy
well, I'm sorry, I shouldn't let you go.
Yes.
I should say that the Nigerian Foundation is very grateful to NTA, because as far back as year 2000, when this was started, NTA was right there in Abuja here, when President Olusegun Obasanjo took the walk with the whole family on the streets of Abuja. And our world president of World Heart Federation also came from Geneva to celebrate and to congratulate Nigeria. How many years ago? 17 years ago. And NTA was like that, and NTA is still there today. So please pass the message. And
I will. I'm sure everybody is hearing.
Nigerian Heart Foundation is very grateful to NTA.
I can assure you that NTA will always partner for things that will make Nigeria an improved society and a better one for all of us.
Thank you.
Well, part of the activities to mark the World Health Day was a press conference that took place at the Federal Ministry of Health. Health Reports was there, and here is the report.
The Federal Ministry of Health is taking steps at addressing the huge burden of heart disease and other non-communicable diseases with the view to protecting the lives of citizens. On this note, we are finalizing the National Policy and Strategic Plan of Action for the prevention and control of NCDs with the support of the World Health Organization. The Strategic Plan of Action adopted the 9 voluntary targets and 25 indicators of the global monitoring framework of NCDs. Overall, we target a 25% relative reduction in overall mortality from cardiovascular diseases, cancers, diabetes, or chronic respiratory diseases by 2025. Similarly, plans have reached advanced stage for the ministry to conduct a national stepwise survey of non-communicable diseases and risk factors in Nigeria, which of course includes cardiovascular disease, to generate local data for proper planning of interventional programs at curbing the menace of non-communicable diseases. In order to help leverage the attainment of universal health coverage, the ministry has planned to adopt and implement the WHO package of essential non-communicable disease into the primary health care services. And it's also with the support of the WHO, and the representative also alluded to that during her own speech. Having recognized tobacco use as a potent and leading risk factor for heart disease and other NCDs, Nigeria ratified the WHO Framework Convention on Tobacco Control, FCTC, in 2005. And through the legal mandate of the FCTC instruments, the Federal Ministry of Health, in collaboration with stakeholders, developed the National Tobacco Control Bill Act, in fact, which has been enacted. We have a National Tobacco Control Act, which was enacted in 2015. We have commenced implementation of some of the provisions that do not necessarily require regulations, because the regulations is also in process.
Well, I'm afraid that's all time will permit on this edition of Health Reports. Take care of your heart, love your heart, move your heart, eat well, stay strong. That way, you'll have a healthy heart to build a strong Nigeria. Thanks for watching. We'll be back same time next week with more issues on Health Reports.